times your heart beats in 1 minute. I'm just trying to explain it from this point of view. Your heart rate is the number of times your heart beats in 1 minute. Heart rate is a measure of cardiac activity. It tells how well your heart is working. It's about cardiac activity. Cardiac means heart. So a slow heart rate is considered anything slower than 60 beats per minute. 60 beats per minute for an adult or a child at rest. That is when you are at rest, when you are not doing any physical activity, you are sitting down quiet, then your heart rate, if its beats are less than 60 beats per minute, that is what we call bradycardia. Bradycardia, it means slow heart rate. Slow heart rate. You see, naturally, our heart is supposed to beat between 60 times per minute to 100 times per minute. That is the natural heart rate for adults, for teenagers, and for that is older teenagers and adults. That is 60 times per minute to 100 times per minute. But it's always advisable that if the heart rate is around that 100, around maybe 9800, it's not too healthy. So it's always better for your heart to beat, let's say, from 60 times per minute to about, let's say, 95 up to 98 times per minute. But any rate below 60 is also not healthy, and that is the bradycardia that we're talking about today. So we will know more about the complications and the other risk factors that are really associated with this heart condition. Someone would say that, why do we talk a lot about heart? Last week we spoke about tachycardia. It means the faster heart rate, because heart disease is a single disease that, in fact, can take people out of this world. All diseases even combined that cannot kill so many people, even half of that rate, half of what heart disease can kill. So it's really number one, and it is a real pandemic, actually. As I was saying here, that in the United Kingdom, every 3 minutes someone dies from heart-related disease. In the United States, every 37 seconds someone dies from heart-related disease. So that's why we need to understand our heart. It's very, very important. But you know what? Let's try to understand it. If the beating is slower than normal rate, it might indicate a medical condition if it is slower than 60 times per minute. But in some cases, especially in athletes, in those that are the sports people, because they do a lot of exercise, they might have strong heart or the strong heart muscles. In that case, athletes, research has shown that their heart rate is less than 60 times per minute, and they don't have any symptoms at all. And you may be among them. Well, you may not be an athlete, but you may have a strong heart that maybe the heart rate is below 60, but you don't have any symptoms at all. So if your heart rate is below 60, but you don't have any symptoms, then of course it is healthy. There's no problem about it at all. So I have clarified this. Although it is between 60 times to 100 times, if your heart rate is below 60 and you don't have any associated symptoms like the athletes, you are a healthy person. So just take note of that. All right. But then if it's below 60, and you have symptoms, then you have a real problem. There's something very serious. But then, the whole idea is about the electrical activity of the heart. You see, the heart, we have the right heart, and then the left heart is one heart, but it's divided. The right heart and then the left heart. And then the heart is divided into 4 chambers. We have the upper chambers, we call the atrium, and then the lower chambers, we call that the ventricles. With the right heart, the upper side, the right atrium, is where we have the pacemaker. The pacemaker, we call it the sinus node. That gives the signals, the electrical signal or the impulse. It sends it around the upper chamber, and then the heart contracts to release blood into the lower chambers, and then it relaxes, and then it pumps blood into the body, and of course to the lungs and the rest of the body. So this is how the heart works. It's very important to understand it. But in bradycardia, the electrical signals are not being released by the sinus node well. That is the problem. That is the main problem. But we'll be looking into the cause very, very soon. But let's understand the symptoms of bradycardia. The symptoms of bradycardia, that is slow heart rate. If your heart rate is below 60 times per minute, and then you have the following symptoms, you need help immediately. That is, the first symptom is feeling dizzy or lightheaded. If you feel lightheaded or feel dizzy, but don't take just one symptom, because there could be other health condition that could also produce the same symptoms. But so put about 4 or 5 symptoms together for you to know that it's really this condition. But the first symptom is feeling dizzy and lightheaded, and then you short of breath, especially when you do something demanding. You go uphill or you climb stairs, and then maybe you didn't used to have this problem. You didn't used to be short of breath. All right, but you're experiencing it now, together with dizziness, and then you're feeling tired all the time. Even after sleeping well, you still feel tired all the time, because the oxygenation in your body is not as it should be, because of circulation is poor. Your blood circulation, the capacity of blood going around has reduced. It might have reduced maybe by 30-40%. So that can cause that. And then also having chest pain. If you have chest pain, that is the same situation here, the same condition. It means that the amount of blood going round and back to the heart has reduced. And if that amount reduces, getting back to the heart, it can be a problem. If you have less blood getting back to the heart, it causes a condition called angina pectoris. It means the pain in the heart. Pain in the heart, so it can cause that. And then it can also lead to your heart pounding. It pounds. That is the palpitation. So it beats very quickly, that you may feel that your heart is beating very, very quickly, and then it stops. It becomes normal again, and then it starts again from time to time. So that's a palpitation. That person, that individual also may feel confused or have a trouble concentrating. That patient may also experience what we call syncope. Syncope is simply about fainting. If that person faints and or is unconscious for about 30 to 45 seconds, the person doesn't know where maybe he or she is. It's a syncope. It means the blood is not getting into your brain or into that person's brain. So that can cause syncope. When we move on, that person can also experience sudden severe headache. So normally that individual may say, oh, because of my blood pressure. Blood pressure doesn't cause headache. But if you have a headache, rather, your blood pressure may shoot up, may go up. So remember, blood pressure will not cause your headaches, but it may be possibly blood not getting into your brain, into the head, can cause headaches. All right. Now, the person also may experience abdominal pain, because the blood getting into the intestines is also not enough. So there is abdominal pain. That person also may experience what we call the pale skin. But if you are a black person, you or a person of color, you may not even realize it, that maybe your color could be bluish, according to medical research, bluish skin color, but we can never tend to bluish. It could be only pale. It means that our oxygenation, the circulation is pretty poor. And that person may also experience a disorientation. You will not know where you are. That's also another symptom. Another symptom is visual changes. and even to some point blindness. So you put all these symptoms together, and then you will know where you stand. That is that if you have bradycardia, that is when your heart rate is below 60 times per minute, and you have all these symptoms. If you have these symptoms, please, and your heart rate is below that, give me a call. Not only bradycardia, but any other disease in the body, call Dr. James on this number. And put the number on before we go to other topics now. The number is 0044 738 464 7300. This number again, +44 738 464 7300. The second number is +44 745 988 9152. This number again, +44 745 988 9152. So please don't hesitate to give me a call, and I'll be very happy to really help you. Any disease, not only bradycardia.